Good morning, everybody. Beautiful morning today. We thank you for being here for our Medicare Benefits webinar. My name is Henry Liu, and we're going to be with you for about the next hour, sharing some information on our hospital, um, Medicare, and some of the health plan benefits. So let's get started. Our agenda today, once again, we're going to talk about HOAG. I'm going to give you an overview and an Advantage plan introduction. About HOAG. HOAG has two main hospital campuses located in Newport Beach and Irvine. We have 14 urgent cares, 9 health centers throughout the county. HOAG's medical staff includes more than 1,700 physicians representing 52 different specialties. HOAG includes 5 specialized institutes of excellence: neurosciences, cancer, heart and vascular, women's, and orthopedics. HOAG is designated as a magnet hospital as part of the American Nurses Credentialing Center's ANCC Magnet Recognition Program. We were ranked the highest ranked hospital in Orange County 5 years in a row. HOAG in your community. Our HOAG health centers. HOAG is committed to providing healthcare services in the communities we serve through our HOAG health centers. We're located in Aliso Viejo, Costa Mesa, Foothill Ranch, Huntington Beach, Irvine Sand Canyon, Irvine Woodbridge, Irvine Woodbury, Newport Beach, and Tustin Legacy. HOAG Urgent Cares. HOAG Urgent Care provides 7 days a week of life's care for 7 days a week of life's unexpected illnesses and injuries. We're located in Aliso Viejo, Foothill Ranch, Huntington Beach, Huntington Harbor, Irvine, Los Olivos, Irvine Orchard Hills, Irvine Sand Canyon, Irvine Woodbridge, Irvine Woodbury, Newport Beach, Newport Coast, Tustin Legacy, Tustin Ranch, and in summer of 2022, we're going to be in Dana Point. We also have a beautiful HOAG Flywell Clinic that's now open at the John Wayne Airport. It's in Terminal B, located in pre-security. Access to primary care. How do you see our primary care physicians? One is through HOAG Medical Group. The other is through HOAG Physician Partners, also known as HPP, which is our IPA. HOAG Medical Group, our primary urgent care and specialty physicians. We have over 100 physicians, 21 primary care locations, 14 urgent care locations. You can find more information at hoagmedicalgroup.com. HOAG Physician Partners, HPP. We have 10 primary care doctors, 350,000 specialists, and service managed care patients. You can find more information about us at hoaghealth.org/HPP. Here's a little overview of HOAG Medical Group. Once again, we have over 100 physicians that specialize in family medicine, internal medicine, pediatrics, geriatrics, sports medicine, allergy and immunology, endocrinology and diabetes, rheumatology, HIV medicine, infectious disease, palliative medicine. We're located in Aliso Viejo, Costa Mesa, Fountain Valley, Foothill Ranch, Huntington Beach, Huntington Harbor, Irvine, Laguna Beach, Newport Beach, San Clemente, and Tustin Legacy. Some of the features that we're really proud of is that we can provide same-day sick appointments for our established patients, and we accept most major HMOs, PPOs, and Medicare insurance plans. And once again, we pride ourselves in unrushed, personalized visits. HPP, HOAG Physician Partners, was our independent physician association. We have 10 primary care physicians and over 350 specialist physicians representing over 50 specialties. Recent additions include Orange Coast Women's Medical Group with over 20 OBGYN physicians at 6 locations, providing an integrated care model for women as they move through all the stages of their lives. HOAG Gynecologic Oncology, HOAG Urologic Oncology, and access to HOAG Network, including HOAG Health Centers and HOAG Urgent Care. You can call our customer service if you have any questions at 1-800-369-9247. Okay, that's the end of my presentation. I would like to introduce you to Jeanette Paterka.
Good morning. My name is Jeanette Paterka. I am a licensed insurance agent, and I am here to talk about Original Medicare today. The picture you see on your screen right now is your Medicare card. The reason you really want to take note of this is that when you are going to enroll yourself into a prescription drug plan or a Medicare health plan, you will need the information from this card. So you want to make sure that you transcribe exactly your Medicare number. This used to be an individual Social Security number, but a few years ago they changed and now it's a new alphanumeric number. And then you want to make sure you take note of your coverage start dates for Medicare Part A and Medicare Part B, which we'll discuss a little bit in just a moment. So what is Medicare? Medicare is health insurance for the following individuals. If you're 65 and older, or if you're under 65 with certain disabilities, it usually means that you've been deemed disabled with Social Security. If you have end-stage renal disease, so if you're if you're on kidney dialysis, or Lou Gehrig's disease. The different parts of Medicare, there's lots of letters, but let's start with Part A. So Part A covers the hospital, skilled nursing facility, hospice care. I like to think of this as when you go into a facility, it's covered under Part A of Medicare. And then Part B covers the medical services you receive when you're in these facilities or in your doctor's office. So Medicare Part B covers doctor's visits, outpatient care, home health care, occupational therapy. That's all covered under Medicare Part B. Then Medicare Part C is Medicare Advantage plans. So the plans that the health insurance plans that are going to be speaking today are all contracted with Hoag, and they're Medicare Advantage plans. They are private insurance companies that have a contract with Medicare to provide benefits to individuals who are that are able to opt into their Medicare benefits. And then Part D, prescription drug plans. There's a couple different ways to receive your Part D benefits. You can purchase one separately, a standalone Part D plan, and you can pair that with a Medicare supplement or original Medicare. Or if you enroll into a Medicare Advantage plan, then you will see today that the plans that are going to be speaking today, those plans have the Medicare health insurance and the drug benefit rolled into one, so it's baked into one standalone plan. So there's different types of different parts of Medicare, and there's different ways to receive your Medicare benefits. So for a Medicare Part A, most individuals that are working and they pay into the system via your deduction that comes out of your paycheck, you're paying into Medicare, and you have to pay into Medicare for 10 years or 40 quarters. And if you do so, then your Medicare Part A does not have a premium. If you are a stay-at-home spouse and you've maybe not worked, you've been at home taking care of children, and you haven't worked those full 10 years or 40 quarters. But if you have a spouse that has, you can opt into Medicare Part A also at no charge based on your spouse paying into the system. Medicare Part B, all individuals that opt into Medicare need to enroll in Medicare Part B, and there is a premium, and it's dependent upon your income. So it's a sliding scale. We're going to go over that in just a minute, but the thing to think about with Medicare Part B is it's not an option. If you're going to be enrolled into Medicare, you have to always pay your Part B premium. It's paid, it's deducted out of your Social Security money. So if you receive your Social Security, they deduct it out of that. Or if you're still maybe working or you've decided to delay your Social Security, that extra award, I call it the award, the money they deposit. If you decided to delay that, they will send you a quarterly statement to pay your Part B premium. Medicare Advantage plans, those are the ones through private insurance companies. Those plans can potentially have a premium, but as you're going to see today, they can go from zero premium all the way up. So if you opt into a Medicare Part C or a Medicare Advantage plan that has a premium, you have to make sure you pay that premium in addition to your Part B premium. And then the Part D, if you opt into a standalone plan, that will have a premium. So the Part B income-based premiums, if you take a look at the second box there, the second line down, this is based on your adjusted gross income. So it's for a single or a married couple filing jointly. So adjusted gross income, if you're single and it's $91,000 or less a year, or if you're married filing jointly, $182,000 or less per year. If you fall into that bracket, each person on Medicare will be paying $170.10 in 2022. So these amounts change every year. And if you go down the scale, you'll see, I'm going to jump all the way to the very bottom. If you are a higher income earner, it can go up to, if you make more as a single individual than $500,000 or $750,000 as a married couple, each of you would pay $578.30. There potentially also could be a Part D income-based premium. As you see in that first level, the $91,000 or the $182,000 or less, there is no additional premium for your Part D coverage. So this is for the drugs. But as you go down the scale, you can see, I'm going to go to the second line there, $91,001 to $114,000. If you look at that line, if you fall into that category, each individual would pay $12.40 for their Medicare Part D premium. Enrollment periods. So what we're looking at here is the scenario if you're going to opt into your Medicare when you turn 65. So you have a 7-month window where you can go ahead, contact Social Security, tell them that you want to activate your Medicare. If I was going to be doing that, same for my birthday's in June, 3 months prior, I would contact Social Security. As soon as I receive my Medicare card, you can enroll into a Medicare health plan starting on 3 months prior to the month of your birthday. What you want to know is that the effective date is always the first of the month of your birthday. So if your birthday is in, say, June 15th, your Medicare is going to go into effect on June 1st. So you have that 7-month window to apply and enroll into a plan. The next enrollment period is the annual election period. We call it the AEP. This is from October 15th to December 7th every year. This is the time when you see lots of commercials about Medicare health plans on the TV. If you are on a Medicare plan, it is basically the time to take a look at the plan that you have, evaluate your coverage, and determine if it's the plan that you want to stay on in the next calendar year. It's the time you can change or enroll in a prescription drug plan. You can change your Medicare Advantage plan, you can return to original Medicare, or you can enroll in a Medicare Advantage plan. So basically, take a look at what you have and determine if you want to move forward in the next year. And if not, you have to submit your application between October 15th and December 7th, and it will become effective on January 1st. The next enrollment period is the open enrollment period. This is January 1st to March 31st. Medicare, a couple years ago, added this particular election for individuals. If you're already enrolled in a Medicare plan, a Medicare Advantage plan, you have a one-time opportunity to make one switch. So you can switch to a different Medicare Advantage plan. You can drop your Medicare Advantage plan and return to original Medicare, which is Part A and B. Or you can sign up for a standalone Medicare Part D plan if you return to a Medicare Advantage plan as well. The effective dates of this particular period are the first of the month following the submission of your application. So if you submit an application on February 20th, it's going to be effective on March 1st. And then you have the lock-in period. So basically, whatever plan you're on as of the end of March, it locks in on April 1st, and you are remain on that plan April 1st through December 31st, and then the cycle starts over again. But there are a few reasons that Medicare does allow you to make a change during this lock-in period. They're special election periods is what they're called. And it's basically enrollment changes that are allowed because of special circumstances, like if you're moving out of your service area. Medicare Advantage plans are filed with Medicare, and they're based on the county that you live in. So if you are living in Orange County and you move to San Diego County, you're going to need to enroll in a new plan because potentially you might have to change insurance companies depending on if it's available in your new county, or enroll in the plan that is based in your county. So you might receive a new set of benefits. You can also enroll in a Medicare Advantage special needs plan at this time. The chronic plans, you can see their chronic conditions. Some of the health insurance companies have insurance plans that are specific to if you have, say, diabetes or heart disease. So you can enroll during the middle of the year on those plans. And then also full dual beneficiaries. Those are individuals that have Medicare and Medi-Cal. So Medicare is the federal program. Medi-Cal is the state low-income program. And then low-income subsidy. We're going to talk about that in a moment, but those are individuals that are maybe on a fixed income, not necessarily, they don't qualify for Medi-Cal, but they have a lower income. Prescription drug coverage. So in 2022, these numbers change every year. So in 2022, these are the baseline numbers. What you're going to hear today is probably going to be more enhanced and you're going to have better coverage, but this is the baseline that Medicare requires. So in the beginning of the year, in January, the way that it would work is you first pay your deductible. So say you go in January, February, or maybe you don't opt in or start your Medicare until June or July. Whenever you start that coverage for that calendar year, you first have to pay your deductible. So say if you have a few prescriptions that aren't really expensive, it might take you 2 or 3 months to reach that $480 deductible. And once you reach that deductible, you move into what they call the initial coverage limit. It's the total annual drug costs combined is how they calculate it. And it's what the total cost is, and it's what's paid by you and your Part D, your insurance company. So the way that it works is that in this example, if you have a $25 generic prescription and you have a $5 copayment, the insurance company pays $20. That $25 is deducted from the initial coverage limit. So between $44.30 before $44.30, once you hit that $44.30, then you move into what they call the coverage gap or the donut hole. And it's a new phase, a different way to pay your prescriptions. Once your combined drug costs have come to $44.30, you're going to pay 25% for your generics and 25% for your name brand medications. And then when your total drug costs, your combined drug costs reach $7,050, you're going to move into what they call the catastrophic limit. This is another way that you pay, and once you hit $7,050, you're going to pay $3.95 or 5% for generics, $9.85 or 5% for all other medications. These numbers calculate throughout the calendar year, and then the following calendar year, they all reset with the new limits and the new numbers. So these are all calculated on an annual basis. So I mentioned low income subsidy. This is a program. It is a federal program, and it's created for individuals who are maybe on a fixed income, but like I said, not necessarily Medi-Cal. They don't qualify for Medi-Cal. You would go to SSI, Social Security, SSI.gov, their website, and you'll find a link that says either Extra Help or LIS, Low Income Subsidy. If you're on a fixed income, I would invite you to go ahead and take a look at this information. And even if you believe your income is a little higher than the guidelines that they provide, I would submit it's a very simple application. And if you qualify within their income guidelines, everything that you think might count towards your income may not. That's why I recommend go ahead. If you feel you're pretty close, go ahead and submit the application. For generics, you're going to pay $0 to $3.95. And for name brands, you're going to pay $0 to $9.85. Okay, so now we're changing gears a little bit. We're looking at a Medigap comparison table. Also, individuals will call it, you'll hear it called a Medicare supplement plan. The plans we've been talking about previously were Medicare Advantage plans. What this is these plans have a monthly premium, and they are standardized, meaning if you enroll into or look at a Blue Shield Plan N, that's the plan all the way to the right-hand side, or a United Healthcare Plan N, the benefits are going to be exactly identical. So what you want to look at is you want to take a look at the monthly premium, because from one insurance company to the next, they can charge a different premium for that Plan N or any of those other plans that you see there. They can charge a monthly premium. So you want to take a look at the premium. You want to look at the reputation of the company. You can also look up online and see the historical rate increases, because these plans do have a premium, and they do and they will go up sometimes more than one time a year. So you want to take a look at that company and how their rate increases over the past few years have looked. And then you can make a decision. So the way that it works is you have Original Medicare, which has a lot of holes or gaps, hence Medigap. So you have Original Medicare, you purchase one of these standalone plans, and then that fills in and helps you cover those gaps. Once you enroll into one of these plans, as long as you continue to pay your monthly premium, those sets of benefits. So say if I enrolled in a Plan N, I always pay my monthly premium. I don't let it lapse. You will always have that exact same set of benefits. If you take a look on the right-hand side, from time to time, you'll see Plan C and F are only available if your Medicare eligibility date was prior to 2020. From time to time, Medicare makes changes to these plans, but remember, whatever you enroll on will stay in place as long as you pay your premium. So Plan C and F, what happened is that Medicare recently made some changes. If your Medicare eligibility was prior to 2020, so in this example, say if you turned 65 in 2018, but you continue to work and you have your employer group plan that you receive your coverage and you decide not to opt into Medicare, or say your spouse, you're 65 in 2018, but you remain on a spouse's work or employer plan, and you don't opt into Medicare. The key there is that you could have prior to 2020. So if your Medicare eligibility date was prior to 2020, then when you do decide, maybe it's age 67, 68, you can select a Plan C or F at that time. So with that, we are going to go ahead and we are going to, the insurance representatives are going to speak, and they're going to go through their sets of benefits. There is a link down at the bottom of the presentation on your screen that also has this presentation, but it also has a form that you can fill out as they go along, but you can refer back to the presentation with the link that is available. So we're going to have the insurance representatives speak. United Healthcare, AARP Medicare Solutions, was not able to be with us today. So Rosalie Puleo, who is the representative that is usually here on behalf of United Healthcare, is not able to attend. So if you want to take a look at her phone number there and jot it down, if you have specific questions pertaining to United Healthcare, you can contact Rosalie. So with that, I am going to be handing it off to Alignment Health Plan. Thank you.
Good morning. Thank you, Hogue, for having us here today. My name is Fernando Galindo. I am a Territory Medicare Sales Representative for Alignment Health Plan. I cover the LA County, Orange County, and the Ventura County. Alignment Health Plan is a 5-star Part D prescription drug plan. The neat thing about that is there's no preferred pharmacies. We have pharmacies that are all contracted with us, so that's a neat thing. We are also a 4-star Part C rated health plan. We have a 90% ranking through CMS Medicare and U-Book, and we have 42 products across 38 markets. We are one of the fastest growing Medicare Advantage health plans in Southern California. The product that I'll be going over today is going to be the AVA PPO 008, also known as Preferred Provider Organization, and this is exclusive with Hogue Network. So we'll go ahead and get started into the benefits. There is a deductible of no deductible. There is a premium of $22 a month with this plan. Your primary care visits and specialist visits within network will be $5 and $20. Out of network will be $40 and $50. Your maximum out of pocket within the network is $3,900. out of network would be $9,500 combined. Does not include RX prescription drug coverage. Hospital copay is $150 per day for the first 3 days within the network. Out of network is 20% coinsurance. Emergency room copay is going to be an $85 copay within network. Outside of the network is the same, 20%. Ambulance copay is going to be a $250 copay, whether it's air or ground within the network. Out of network is a 30% coinsurance. Outpatient surgery copay is going to be $165 for hospital within the network, and out of network would be a 25% coinsurance. Skilled nursing facility copay is going to be $120. It's going to be $0 for day 1 through 20. Day 21 through 51 would be $100. Out of network would be a 30% coinsurance. X-rays and laboratories, that'll be a $15 copay for your X-rays. Laboratories, $0. 30% coinsurance for out of network. MRIs and CT scans in network would be a $150 copay. Out of network would be 30%. Diagnostic testing is a $0 copay. Out of network is 30%. Physical therapy in network is a $0 copay. Out of network is 30%. Urgent care in network is a $20 copay. Out of network is a $20 copay as well. Waived if admitted in the hospital. Your RX prescription drug coverage, our tier 1 is going to be a $0 copay. Our tier 2 is going to be a $5 copay. And our tier 3 is going to be a $40 copay. Our tier 4 would be a $100 copay. Tier 5 is going to be a 33% coinsurance. And then our tier 6 is going to be a $0 copay if prescribed for a 100-day supply. Again, our pharmacies are not a preferred pharmacy system, so you can go to any CVS, Rite Aid, Walgreens, any contracted pharmacy. There is no preferred network with us. Another thing that we're going to have is vision coverage. You have your yearly eye exam for free. It's through VSP. It's a $150 allowance towards eyeglasses every 2 years. Health club membership is included through Peer Fitness Moves. And some of the extras that you can get through our Option Plus package is dental coverage. And that is a $62 premium through the Option Plus package. That includes the dental and its Delta Dental PPO plan, a $1,500 coverage limit per year. Also included in the Option Plus package is hearing aids. That's your yearly hearing exam once a year for free, and a $2,000 allowance towards hearing aids every 2 years. Also included in the Option Plus package is transportation. That's 12 one-way trips throughout the year at a $0 cost, as long as you call us 24 hours in advance. We also include the PERS, which is a personal emergency response monitor, with the Option Plus package. And you also get an extra $15,000 worldwide emergency coverage within that plan. For all my members that are either considering or looking into supplemental plans, the AVA PPO Plan 008 is a really good option for you. The premium is only $22 a month. Your buy-up option is $62 a month, totals out to $84. No underwriting, freedom to see doctors, out of network, no referrals or specialists. This could make sense to switch for someone who's looking from a supplemental to a PPO plan. I'd like to take the opportunity to thank Hope for having us here today. This is Alignment Health Plan, and my name is Fernando Galindo. Thank you for having us, and I'll send this off over to Evan, who will be presenting Anthem. Thank you.
Hi, good morning, guys. My name is Evan Baker, and I'm a local licensed Medicare sales agent. So what that means is I'm trained and certified in a lot of the carriers throughout Southern California. Today, I'm very excited to talk with you all about Anthem and their flagship plan offering known as the MediBlue Select Plan. So what I'd like to do first is just go through, help you guys fill out your benefit cheat sheet, talk about some of the copays, the benefit areas, and then afterwards, talk about a few of the extra benefits, as well as some of the things that make Anthem a unique and attractive option for you. So let's start at the top. You have the star rating for Anthem, and this MediBlue Select plan is a 3.5 star plan. Anthem reps have said they expect it to improve, but again, that's not a guarantee. In terms of the premium, you're going to see a lot of zeros for these benefits. The premium to be on this plan is $0. For your office visits, your primary care specialist visits, that's a $0 copay. Your maximum out-of-pocket, this is a $900 limit. One of the things to keep in mind is that your prescription drug copays do not factor into this maximum out-of-pocket. You have your inpatient hospitalization copay. That's $0 copay per stay for an unlimited number of days. In terms of your emergency room coverage, you have a $90 copay. However, if you are admitted to the hospital within 24 hours, that is waived. In terms of your ambulance copayments, Anthem does a neat thing where they cover your air ambulance for a $200 copay, and that $200 copay also applies to ground ambulance and water ambulance. Outpatient surgery, things like knee surgeries, hip surgeries, that's a $0 copay. Skilled nursing facility. These are the situations where, if you've been hospitalized and you're, healthy enough to be discharged, but not healthy enough to go home without skilled care, Anthem covers you for days 1 through 20 at a $0 copay, days 21 through 100 at a $75 copay, okay? In terms of all the routine, regular things like x-rays and blood work and lab work, that's a $0 copay. MRIs and CT scans, $0 copay. Diagnostic testing, again, that's a $0 copay. Physical therapy is a $0 copay. Urgent care, again, is a $0 copay. So let's talk a little bit about the medication and the Part D coverage that's included with this plan. For all of your Tier 1, meaning your preferred generic drugs, it's a $0 copay. For your Tier 2 medications, you're going to have a $5 copay for a 30-day supply at a preferred retail pharmacy. However, if you get those Tier 2 medications sent to you through Anthem's mail order service, that's a $0 copay. You can do that for a 90-day supply or 100-day supply. In terms of your Tier 3 medications, it's a $42 copay. Tier 4, these are your brand names. It's a $95 copay. And for your Tier 5 specialty drugs, it's a 33% coinsurance. For your select or maintenance medications, those are often referred to as Tier 6, the $0 copay. Now we're going to start talking about some of the extra benefits. And what I'd like to do is for these areas, just go ahead and put a star next to them, and I'll tell you why in just a second. But let's start with the dental coverage. So Anthem, at the basic included level, covers preventive services. These are things like x-rays, exams, basic cleanings. You have the option, you can buy up more comprehensive services. For hearing aids, Anthem is a leader in hearing aid choice and selection and also allowance. And what I mean by that is they provide you a $3,000 benefit per year. So they use hearing care solutions, a lot of locations locally. You'll go for a $0 hearing exam. And then, if the audiologist finds that you need hearing aids, you'll have a very wide selection to choose from and a $3,000 allowance to use towards those. So it's very helpful. For vision coverage, Anthem provides a $150 allowance annually. They use their own network called Blue Vision, so there's a lot of participating providers. Go ahead and put a star by that one as well. And for your fitness or health club membership, Anthem uses a very popular network, Silver Sneakers. So a lot of gym locations around the country, actually. So you can go to a lot of different places to work out. Now, transportation. Anthem has, in the basic embedded version, 12 transportation rides, one-way trips included. Put a star by this one as well. And then at this point, it's important to talk about, why did we have a star there? Anthem does something that's very unique amongst all the plans in the area. They have what are known as essential extras. So this is a very unique thing that Anthem's done this year. Not many of the other companies are doing this. And what the essential extras are, think of it this way. You have all of those benefits, vision, dental, hearing, things that Medicare doesn't cover by itself, but are covered within your plan. Anthem takes it a step further, and so they add an extra layer of these benefits. And so these are some very helpful things, and I'll go through the list. You can see them on the screen. Now, with this MediBlue Select plan, Anthem allows you to pick 2 out of these 9 benefits, and you can custom tailor these and this plan to meet your needs. That's what's so unique and wonderful about this. So the first benefit is Assistive Devices. So this is a routine annual allowance of $500 towards things like shower rails, assistive safety devices, raised toilet seats, temporary mobility ramps. A big seller with this is the HEPA air filters. There's a $200 value in that. The next benefit that's very popular, and a lot of you guys have probably seen this advertised on YouTube, the Flex Card, the Flex account. This is a $500 MasterCard debit card that you can use at either your dental, vision, or hearing to help stretch those, hearing aid benefit of $3,000. If you use your $500 towards the hearing, you can have $3,500 potentially. So it's a very nice way to be flexible with your health plan. They also include a health and fitness tracker. You can select that as well. Healthy groceries. So this is a very helpful benefit. If you have a diagnosed chronic condition, Anthem will send you a grocery card that you can use to order healthy groceries. Things like meat, vegetables. So this excludes any items like alcohol, tobacco, candy, things like that. So this is a very helpful benefit, especially because food prices have gone up in the pandemic. Next is healthy meals. So this is useful if your doctor has prescribed or feels that you need warm delivered meals to your home. So this is doctor prescribed. It's very helpful. Well, they'll deliver up to 2 meals a day for 90 days to support your nutritional needs, which is great. Another big and popular benefit is the in-home support. Anthem uses a company called Papa's, and they have representatives known as PALs who will come to your house for up to 60 hours per year just to provide, companionship, watch some Netflix with you, help you with light chores around the house, like folding laundry, going through bills. So that's a wonderful benefit. Additionally, they have a more medically focused in-home help, and that's known as the Personal Home Helper. Now, Anthem provides up to 31 visits, which is 4 hours per visit of home health aid services. So these are things that are geared towards helping you with activities of daily living. Things like bathing, toileting, transferring, eating. So Anthem, they'll use this company to come in and help you do those essential activities for daily living. Another popular one is Pest Control. Anthem uses Terminex. And so, quarterly, they can send somebody out to your house to just do some routine pest maintenance. If, it's deemed that your home is in need of a huge fumigation, then that's a $5,000 value that Anthem, can provide for you if it's needed. Additionally, transportation. So if you're the kind of person who needs one-way trips, if you don't drive, then this can be a helpful benefit because this lets you augment or add to the 12 embedded one-way trips with this plan. So it can give you up to 60 one-way trips. Another key area to talk about really quick are the other basics embedded, like the PERS, the Personal Emergency Response System, where that, helps keep track of you if you fall. Think of it like the Help I've Fallen and I Can't Get Up necklace. So it's a modern version of that, which is wonderful. They have Live Health, a $0 copay for a virtual doctor visit, a 24/7 nurse hotline, $100,000 worldwide emergency coverage if you ever travel outside the U.S. They include 24 acupuncture visits at a $0 copay, 12 chiropractic visits at a $0 copay. They include 4 Viagra or generics for a $0 copay per month. They even include post-discharge meals if you've gotten out of the hospital, 2 per day for 7 days. And the last one and the most popular is the over-the-counter item benefit. Anthem provides you with $80 allowance every quarter of the year to order things like multivitamins, toothpaste, toothbrush, Band-Aids, heating pads, incontinence supplies. So there's a large list that will be very helpful for you, and this benefit rolls over. So that's all, a lot of information. If you guys have questions about any of the vendors or this Anthem plan, please feel free to contact me at 714-602-0807. And I think I'm all done. I want to bring up Diana No with Blue Shield of California, and she'll be your next speaker. Thank you all for having me.
Good morning, everyone. My name is Diana No, and I am an independent broker, and today I'll be representing Blue Shield of California. My contact information will be listed in the chat box. However, for folks that are not viewing this session live, my telephone number is 949-226-4064. A little bit about Blue Shield of California. They are a not-for-profit company based here in California. They've been in the healthcare industry for over 80 years, and they're here to service you and provide you a variety of products. Blue Shield is a one-stop shop. What does that mean? They offer a variety of products such as a Medicare Advantage plan, Medicare Supplement, as well as prescription drug plans. And depending what you're interested in, there'll be something that will fit your budget and your needs. So today I'll be reviewing the leading plan in Orange County, which is called Blue Shield Inspire. So in the description box, you should have seen a copy of the comparison worksheet. So this is what I'll be going off of. Once again, this plan is called Blue Shield Inspire. So in front of you here, we have a copy of the benefit highlights. It's a high overview of the benefits that we have for this plan. However, I'll be going a little bit more details on the comparison worksheet. This plan is rated at a 4-star, and there's no additional premium to join this plan, as long as you continue paying your Part B premium, as Jeanette mentioned earlier in the Medicare component. There's no additional premium, so you pay $0. For your primary care and your specialist visit, also $0 copay. No payments for there. As for your maximum out-of-pocket, the most you'll pay for your medical and hospital expenses for the year is $799. That is the max. That is your cap. There'll be a couple of copayments, which I'll talk about here. Those medical and hospital copayments will go towards your maximum out-of-pocket. So, for example, if you had to go to the emergency room, it's an $85 copayment. If you had to call the ambulance to take you to the emergency room, that's a $100 copayment. Those copayments will go towards your maximum out-of-pocket. With the Blue Shield plan, they do also offer worldwide emergency and urgent care services. So let's say you're traveling outside the states, internationally, domestically, and you encounter an emergency or need urgent services, you are covered at the set copayment of $85 and it's unlimited expenses. Moving on to outpatient surgery services, excuse me. If you needed a colonoscopy, cataract surgery, for the procedure done at an ambulatory surgical center, it's a $0 copay. However, if you're a high-risk individual and your doctor may say, hey, you need your cataract surgery over at the hospital campus, that will be considered as outpatient hospital facility, then it's a $150 copayment. Your doctor will determine whether you go to an ambulatory surgical center or the outpatient hospital facility. As for skilled nursing, this is, let's say you had a procedure done at the hospital and you're well enough to be discharged, but not well enough to go home. You may be discharged to skilled nursing for extra rehab services, extra care, etc. On Blue Shield, the first 20 days, it's a $0 copay. You pay $0 for the first 20 days. However, if you're there from days 21 to 100 days, it's a $50 copayment per day. So you may be asking, Diana, if I end up staying there 100 days, am I responsible for $4,000? The answer is yes and no. You are responsible up to $799, which is the maximum out-of-pocket. After that, you stop paying for your medical expenses for the year. Moving along to the next few items, a lot of zeros. So for your x-rays, your labs, your MRIs, CT, PET scans, diagnostic testing, if you need physical therapy, speech therapy, occupational therapy, as well as urgent care services, it's a zero copay. You pay nothing out of pocket for those services or those benefits. Now moving on to the prescription drug coverage. Blue Shield has a very robust formulary list of medications covered. So you may find a lot of medications covered on Blue Shield, and you may not see it with other companies. So I will go over the co-payments for the preferred pharmacies. So if you have your medications filled at like CVS, Costco, Walmart, Albertsons, Ralph's, Save-Ons, and so forth, that's considered our preferred pharmacy. And Blue Shield is contracted with over 6,000 locations. So for Tier 1, I'm going to give you a 30-day supply as well as a 90-day supply. So for Tier 1, it's the preferred generics. It'll be a zero copay for both 30-day and 90-day. As for Tier 2, your typical generics is $3 and $4.50. Tier 3, these are typically your brand name medications. So you're looking at the Eliquis, your insulin, some inhalers like albuterol, maybe Advair. You're looking at $35 a month or $87.50 for a 90-day supply. Moving on to Tier 4, this is the non-preferred brand names, so it's $95 and $237.50 for a 90-day supply. And lastly, Tier 5. It is a 33% coinsurance. So what falls under Tier 5? Typically, these are your injectables and your like chemotherapy medications that you're prescribed at the pharmacy. Okay, so this is different from infusions. This is if your doctor writes you a script for a chemotherapy pill or medication and you fill it at the pharmacy. This plan does not have a Tier 6. As for dental coverage, yes, this plan does offer basic dental coverage for your cleanings, x-rays, and exam. However, if you prefer to use your own dentist and maybe the doctor's not in the dental network that we will offer, you do have the option to upgrade your dental plan to a PPO plan. This plan also includes hearing aids. So if you get a hearing exam, it's a zero copay, but it's determined that you may need a hearing aid. This plan does include hearing aid coverage for a set copayment. So there are two types of hearing aids available. So there's the basic level, which is $499 per ear for the silver technology. And if you need a higher end, a premier type of hearing aid, then it's $699 per ear for the golden technology. The hearing aids are covered through a company called Epic Hearing. So that's the company that works with many of the local audiologists in the area to provide the service. As for your vision, so this is for your glasses or contacts, right? A little bit different than your cataract and glaucoma. So this is for your optometrist. Blue Shield uses VSP as their vision administrator. So there's many doctors in the area that accept VSP. You receive a $200 allowance for your frames and contact lenses, but your exam is zero and your lens is zero as long as it's the basics. But you do get a $200 allowance for your frames and contact lenses. And once again, the vendor, the vision administrator, is VSP. As for the health club membership, yes, also included on this plan. It is through a company called Silver Sneakers. You may be familiar with that company. They work with many of the local gyms in the area like YMCA, 24 Hour Fitness, LA Fitness. As long as you're on this plan, you have access to Silver Sneakers and you will have access to all those gyms. So you can belong to more than one gym. So let's say you like 24 Hour Fitness because they have extended hours, but you like LA Fitness because they have maybe a better lap pool. You can belong to both gyms as long as you're actively on this plan. As for transportation, it is also included on this plan. Let's say you're not feeling well enough and you need a ride to the pharmacy or the lab or urgent care, and maybe you couldn't coordinate a ride with a family member or friend. This plan also includes transportation at no cost to you, and you receive 32 one-way trips per year. Lastly, a few extras that are available on this plan. You also receive a $100 allowance per quarter for over-the-counter items. So this is a great benefit. $100 is quite a bit to buy things like cough drops, ibuprofen. We have cotton swabs, hand sanitizers, tissue paper. So there's a catalog, super easy peasy to order. You can either order online or call in, but you do have $100 each quarter to spend on those items, and it's shipped to your home at no cost to you. This plan also includes the medical alert device, so you may have heard them called as PERS, so the Personal Emergency Response System. It is through a company called LifeStation, and dependent on your lifestyle, activity level, you can get the traditional bracelets, pendants, or they also have a GPS mobile device, once again, at no cost to you. Blue Shield also offers acupuncture and chiropractic services. So if you are someone that is an avid user for alternative medicine services, this plan includes 24 visits each. So 24 visits for acupuncture, 24 visits for chiropractic at zero cost to you. You just have to use the company that they are contracted with. So it is American Specialty Network. So that is a group of chiropractors and acupuncturists that are in that network. Lastly, home delivered meals. So this is something new that Blue Shield added this year. When you're discharged from the hospital, maybe skilled nursing, and maybe you're not 100% well enough to start back in your daily routine of meal prepping and so forth, this plan includes home delivered meals after discharge from the hospital or skilled nursing. So per discharge, you get 22 meals as well as 10 snacks. Okay. As I mentioned earlier, Blue Shield's a one-stop shop. So I just went over a Medicare Advantage plan, but if you're interested in a Medicare supplement plan or prescription drug plans, they have it as well. Lastly, I do want to mention for my folks that are watching, if you are currently on a Medicare Advantage plan and you're interested in switching over to a Medicare supplement plan, Blue Shield is offering a special underwriting holiday, meaning if you are interested in switching over to a Medicare Advantage plan to a supplement plan, you can switch with no questions asked. The deadline for that enrollment is February 28th. So you have a few weeks left to make that decision if you want to switch over to Medicare supplement. With that being said, for more information, you're welcome to give me a call. My number is 949-226-4064. Thank you for joining us today, and I am going to now introduce SCAN. We have Joanne Baudet, who is my fellow associate. Thank you.
Good morning and welcome, and thank you, Hogue, for hosting us and letting us come out here and sharing our great information with you. Welcome to Medicare if you're brand new. My name is Joanne Baudet. I work for SCAN Health Plan. I work directly for the company. I am a sales representative. I've been in this business for over 25 years. So if there's questions about Medicare that you have, I'm your person. If I don't know the answer, I definitely know where to go find it. I can help you get enrolled. I can help you if you need forms from your employer. I can help you decipher the differences between all the plans and the different options that you have. So I'd love to help you out. My phone number is 714-272-8983. Again, that's 714-272-8983. You can call me, text me, send me an email. My information is also on the screen. Okay. SCAN is a Medicare Advantage plan. We only enroll folks who have Medicare. So if you've never heard about us, it's because we are a Medicare only plan. And so we have several plans. We have plans for everyone that lives in the service area, which would be any part of Orange County, LA, San Diego, Riverside. We also have plans that are designed for people who have diabetes. And if you have that, our plan is phenomenal because it gives you your insulin at a zero copay. And we have plans that are designed for people that are on low income. So today I'm going to go over our classic plan. The classic plan is offered in Orange County. We have Hogue Hospital, of course, and Hogue Medical Group. We also contract with quite a few other medical groups in Orange County if that's something that you're interested in as well. We are a 4.5-star rated plan. We have a zero premium. We also have zero for your primary care and your specialist. Maximum out of pocket, I think they probably went over that for you, but it's only $499 with this plan. That's incredible. Okay, so maximum out of pocket for the year of 2022 would be $499 for you. Hospital copay is zero. Emergency room is $90, but it is waived if you're hospitalized. Ambulance is $100. And outpatient surgery is zero, whether it's done at a surgical center or if it's done at the hospital level. Skilled nursing is zero. No matter how many days you stay, Medicare has a benefit up to 100 days. You would pay nothing. X-ray and labs, zero. MRI, CT scans, CAT scans, all zero copay. Diagnostic testing, this is like radiation, would be a $50 copay. But don't forget, we have the maximum $499 out of pocket. Physical therapy is zero. Urgent care, zero. That's urgent care locally with your medical group. Hoag has great urgent care offices, or anywhere in the world. We cover you for emergencies and urgencies worldwide, and it's a zero copay. Prescriptions. Prescriptions, we cover you 3 different ways. You can go to a preferred pharmacy, you can go to a standard pharmacy, or you can use our mail order, which is called Express Scripts. In any case, you can get 30-day supply, or you can get as much as a 3-month supply. And with Scan, a 3-month supply can mean 100 pills versus 90. If you go to a preferred pharmacy, it means you went to a CVS, a Rite Aid, a Vons, Albertsons, Costco, Sam's Club. If you're going to a standard pharmacy, you went into a Walgreens, you walked into a medicine shop, or some small independent pharmacies. You can use them, but you're going to pay a little bit more. So today I'm going to go over the preferred pharmacy copays. Medications are divided by tiers. We have 5 tiers with Scan. And on our first tier, and tier 1 and tier 2 are going to be your generic medications. Those are going to be a zero copay, whether you get a 30-day or if you get a 3-month supply. Tier 3 are your brand name medications, $30 for a 1-month supply or $70 for a 3-month supply. That's a $20 savings by going 3 months. And then tier 4 is $95 for 1 month and $265 for a 3-month supply. Those tier 4 are ones that we see advertised on TV a lot. They're extremely expensive. And tier 5 is a 33% copay. No tier 6. Dental coverage, we have a coverage that's offered by Delta Dental. It is an HMO plan, but we have thousands of dentists here in Orange County that will take the plan. Coverage for your cleanings and x-rays are zero. Your routine visits are zero copay, and then even if you needed a deep cleaning, that's still a zero copay. Then there's discounts for other items like root canals and crowns, fillings, bridges, dentures, things like that. That would be given to you at a 30 to 60% discount. And there's no limit to how much dental work you can have done, and there's no waiting period. Hearing aids are through a company called True Hearing. You get them at a highly discounted price, $450 to $750, depending on the type of hearing aid you need. And those hearing aids usually retail for $2,000 to $4,000. Vision is our iMed coverage. iMed is Sears is, I keep doing that, they're out of business. You can go to Lens Crafters. You can go to America's Best. That's the new one with the owl on the commercial. That's actually where I got my glasses. You can go to a lot of independent optometry offices. There's hundreds here locally in the Orange County area. You get your eyes examined for no charge, and you get an allowance to spend on either contact lenses or on your glasses, and the allowance would be $250. You get a pair of glasses or contact lenses every 2 years and your exam every year. Gym membership is the same as the other plans. It's called Silver Sneakers. They're a great program because they have programs online. They have walking programs. They also include, of course, most of the gyms in the area. Over-the-counter transportation. We cover you for transportation. You get 32 rides. That's to and from the doctors, the x-rays, the lab, the pharmacy. There's no charge for that, and it's curb-to-curb service. The extras we have is things like over-the-counter items. Those are things you can order through a catalog, and you can spend Scan money. You would spend $50 every quarter on things in that catalog like vitamins, minerals, Band-Aids. They have a blood pressure cuff, even electric toothbrushes in there. Okay. Also we give you acupuncture, chiropractic coverage that would be through a group called ASH, American Specialty Health. That would be a $15 copay, and you get up to 30 visits a year. Podiatry is also covered for routine. Routine meaning toenail clipping, callus removal, crowns, corns. Those kind of things would be covered under routine care, and there's no charge for that, and you can go 6 times a year to the podiatry office. We have a program called Health Tech, where you can call a board-certified physician 24 hours a day, 7 days a week. And that would be, say, Saturday morning, you wake up, you're not feeling well, and instead of getting dressed and going to urgent care, you could just pick up the phone and speak to a doctor. They can call you back on FaceTime, or they can do a Zoom call, take a look, maybe your eye is swollen, maybe you have a rash. Talk to them, they can order your prescriptions, because this is a board-certified physician, not a nurse practitioner, not a nurse, but an actual doctor that you can call. There's no limit to how many times you call. You can call from anywhere in the United States, and they are open 24 hours a day, 7 days a week. One of my favorites is called Returning to Home. This is a program that we offer where we give 40 hours of routine care at home once you return home from the hospital. So say you go into the hospital, you come home and you need a little extra help at home. Maybe you need help getting a bath, getting dressed in the morning, maybe changing the linens on the bed, doing some laundry, some light housekeeping. We're going to cover you up to 40 hours of care for that at no charge. We're also going to add food delivery for that period. If you get home from the hospital and you need food delivered to the house, we're going to do 28 days worth of food. That's 84 meals. We'll design the meals directly designed towards your taste, your medical needs, and we'll get those sent out to you at home. And then our emergency response system, that's the system where it says, help, I fell, I can't get up. That's also going to be covered for you under SCAN. And then the one other thing is it's called the Fitbit. Fitbit is like a watch that you wear, and it counts your steps. It keeps track of your heart rate, your sleeping patterns. Really nice program. It retails for about $85 to $125. We send those out to our members for no charge. We do ask that you call and ask for one. We don't want to waste the Medicare dollars if it's something that you're not interested in. But we have over 350 members of our SCAN that are over 100 years old. So we're not sure if everybody wants that Fitbit, but we're happy to send it out to you. So just keep in mind that we are a local company. We're here in Long Beach. We're happy to, our member service is happy to answer your calls 8 in the morning to 8 o'clock at night. But if you do enroll with me, you'll get me as your agent, and I'm happy to help you all year long. So you can call my number direct. I do answer my calls even through the weekend. So if you have questions or anything like that about Medicare, about SCAN Health Plan, I'm happy to take your call. Again, my number is 714-272-8983, 714-272-8983. So now I'm going to turn it over to Henry, and he's going to close the meeting today. All right? Thank you so much.
Hello again, everybody. Thank you. We want to thank you on behalf of Hoag Hospital. We just want to thank you for being here, taking time out of your Saturday morning to join us. I want to thank Jeanette for giving us a great overview on Medicare and all the individual representatives from all the health plans. It's a lot of information, but don't forget, you could go to our YouTube channel, and if you look under where our presentation is today, you'll see 2 links, and you can click on those links and you can pull information on the presentation and all the differentiating factors between the different plans and the services they offer. So once again, on behalf of Hoag Hospital, we just wanted to thank you for being here. Have a great Saturday. and a great rest of the weekend. See you later.